Hey, do you want to know how often should a woman get a pelvic exam and a pap test? Well, ladies and gentlemen, my name is Saurav Singh, and please here I'm going to give you a solution. Give me your ear and eyeballs. A pelvic exam and pap test are cancer prevention screenings. Yes, performed during a visit to your gynecologist to check for abnormalities or gynecological cancers. These tests are important to have done as they can detect issues early when they are most treatable. Previously, gynecologists recommended getting a pelvic exam and a pap test once a year. However, since cervical cancer typically develops slowly, these guidelines have changed. Now, doctors recommend getting these tests done every 3 to 5 years, depending on your age. Pelvic exams and pap smear test are typically performed during an annual women exam. Pelvic exams are done to diagnose or detect signs of different gynecological conditions, including pre-cancerous cervical changes, pelvic inflammatory diseases, sexually transmitted diseases, gynecologic cancers, cysts such as ovarian cyst, uterine fibroids, or you can say uterine fibroids. These are typically bench tumors that develop in the uterus. Polyps, fingerline growth in the cervical canal that are easy to remove. Well, if you're thinking, what happens during a pelvic exam? Wait, I'm going to tell you. During a pelvic exam, you will go through 3 separate exams. First, external exam. Your doctor will look at your vulva and the opening of your vagina for any discharge, irritation, warts or cyst. Second, speculum exam. A tool called a speculum is inserted into your vagina. When the speculum opens, it separates the walls of your vagina. If you're getting a pap smear or HPV test, your doctor will wipe a small sample of your cervical cells and send the sample to the lab for testing. Well, ladies and gentlemen, the third is bimanual exam. Now, what is bimanual exam? Your doctor will put gloved and lubricated fingers into your vagina while pressing on your lower abdomen. Well, these allows them to check the shape, size, position of your uterus and for possible enlarged organs, tumors or any tenderness or pain. Ladies and gentlemen, after your pelvic exam, the doctor will talk to you about any abnormalities they found. If you have a pap test, your results won't be available for a few days. If abnormal cell growth is detected, your doctor may recommend additional testing and you may need to have more frequent pap tests in the future. Now, if you are thinking, when should you have a pelvic exam and a pap smear? When? I'm going to tell you. A pelvic exam examines the vulva, vagina, uterus, cervix, pelvis, ovaries, and rectum. A pap smear looks for abnormal cells that may develop into cancer. Yeah. Now, if you have a question, how often you should have a pelvic exam and a pap test? It depends on your medical history and age. Doctors may also perform an HPV test. What is HPV test? Well, HPV is a sexually transmitted infection spread by oral sex, vaginal sex, or anal sex. While it can sometimes go away on its own, some HPV types can cause cancer. Yes, most doctors recommend the following. Now listen to me very carefully, ladies and gentlemen. If you are in between of age 21 to 29, a pap test should be done, must be done for 3 years. If you're around 30 to 65, both a pap test and HPV test can be done every 3 years, or you can have a pap test alone every 3 years. After 65 plus, you can stop getting these tests if you haven't had abnormal cervical cells or cervical cancer and have had several negative test results in a row. Now, if you think, when do I need more frequent pelvic exam or pap smear test? When? I have an answer for you. You may need more frequent pelvic exam or pap test if you have a history of abnormal pap test result, or have a family history of sexual health problems or cancer, or have a history of cervical cancer, or if you are HIV positive, or if you have a weakened immune system. Weak immune system, or ladies and gentlemen, if you have a sexually transmitted disease, that is STD. Well, ladies and gentlemen, this was it. My name is Saurav Singh. Kindly make sure to subscribe this channel because I will keep coming with your problems with solutions. Thank you so much. Your host, your friend and confidant, Saurav Singh. Bye.